So, Andrea, when you are working with the hypermobile population and you're looking at their feet and ankles, what sort of general advice would you give dancers with hypermobile feet and ankles on how to work with their physical therapist, some general guidelines on how to take care of their feet?
There is some evidence out there that individuals with hypermobility and certainly those that have been diagnosed with EDS do get more foot problems than maybe the rest of the population. But most importantly, as many of these issues will respond very well to interventions. So don't be afraid to seek those out. I think in terms of how you want to keep your feet healthy and supported, I think it's really important to focus on strength conditioning, and strength conditioning that doesn't necessarily look like you're dancing. That could be, we could look at that a couple different ways, right? You could do strength conditioning that doesn't really mimic the patterns that you're moving in with dancing, in terms of as a way to kind of balance you out. Right? Like a lot of, working kind of in the straight sagittal plane, that's forward movement, backward movement, it's considered to be like a power position of the body that oftentimes you don't get in dancing, certainly in dance techniques that involve external rotation of the body, right? But kind of bringing you into parallel can really kind of, it keeps you honest.
Mm-hmm.
Keeps you honest.
It
And it
does.
also, I think, kind of balances out, it puts a stretch on some of those tissues that are going to become very tight and short from being in external rotation, right?
Mhm.
So I think focusing on strength conditioning, but that being said, there's this principle of specificity. And, if you want to get better at something, you want to get stronger with something, well, you're going to you need to train your muscular system to respond to that. So I think starting maybe with more functional movements, but then, and this is where your work, Jennifer, gets so interesting. it's like really taking that and making it more dance-based in the sense that it's like soup to nuts. It's like the whole meal. It's not just one part of it. It's really kind of looking at how those muscles work together in a dance-based pattern. Might not be the exact movement, but really trains those muscles to work in a lengthened position. So, I think that closed chain strengthening that is, maybe more functional, not dance-based, but also considering exactly what you're struggling with is important, and allowing you to work multiplanar, sagittal plane, transverse plane, coronal plane, getting to that. So there's some kind of transfer over, right? Working on like a parallel squat is going to get you far, but maybe it's not going to help you with, whatever it is, your penché arabesque. I think that you can focus on mindful stretching and maintenance of full range of motion, which kind of could be a paradox. So why would a hypermobile body need to stretch? Well, I find that hypermobile joints, they may result in excessive tightness of the surrounding muscles and tendons due to overcompensation. Be really, and this is where, those of you who are listening to this, who do manual therapy techniques as a physical therapist, you can really target your work to just work around kind of freeing the joints of this restriction rather than saying we're going to do this stretch of the hamstring and the dancer's like, I feel nothing and my shin is 2 inches from my forehead. You can really, address, there are soft tissue restrictions that do happen in a hypermobile body that might need to be opened up a little bit to help restore alignment. So kind of controlled stretching of the global musculature, like the calves, the hamstrings, the quads, the gluteus maximus, might be needed. But you might need to get very creative that they actually can feel they are actually targeting the tissue and they're not just pushing into the joints. And certainly controlled stretching can be, again, controlling that range of motion, no overstretching, hyper splits. You don't need it. You have it. So I definitely, everyone knows not to overstretch and oversplit around me. Because I will just not stop talking about it. I also think that, you can possibly, again, it's very circumstantial, maybe do some very, very light fascial release techniques yourselves, but be very careful about irritating the soft tissues. And especially if you have issues of fragile skin. Sometimes I'll get my dancers will get on the table and it looks like, the street sweeper ran over their calves. I was like, what is going on here? It's bruised and red. And, I've been working on a ball with my calves for how long? 20 minutes. Okay. Talk about it.
Okay.
So, again, you want to make sure you're not over treating. You might not need to do all of that to help yourself feel like you're restoring mobility. You also want to make sure you don't release too much, because you might be releasing whatever it is that's holding you together. So the iliotibial tract. Now, we're not really going to release the IT band, right? The IT band is a strong fascia, but again, we can work on the musculature that's around it that can maybe alleviate some increased tension. But if you're on that foam roller all the time, you might be releasing the only thing that is holding you together. And you do too much of that, you're going to potentially feel like you're really soupy afterwards at your pelvis, at your hips, at your knees, and your feet. So again, just education of the your dancers, and just knowing that you do need a certain amount of muscle tension and tone in your body, right? And sometimes the irritation that you feel is because your tissues are irritated, not tight. So again, trying to get that guidance from the teachers, from your somatics practitioners, from your physical therapist on exactly what you need to do in terms of just addressing any fascial issue that's not a strength issue. I think there's a large, it's huge room for intervention here in terms of education. I think it's really important to optimize your joint position sense. So really keep it simple. Keep it simple. How can you correctly load through your leg? How can you get onto your leg without feeling like things are slipping out of place? So considering the hip, the knee, and the foot and the ankle together.
Absolutely.
And in weight bearing is key. And figuring out creative challenges in terms of how you could maybe challenge the stirrup muscles around the foot and the ankle. And that midfoot that stabilizes that midfoot, that helps with that ankle alignment. How can you do that in more of a weight-bearing sense? So you're giving the dancer with hypermobility more information proprioceptively through the loading from the ground force that could help them feel what the right position is. If you have an altered joint position sense, sometimes the most difficult position to do exercises is in a non-weight bearing position. It's like you don't know where you are. Maybe, at a certain, when you're learning to undo something or recognize a habit or kind of trying to restore stability or reintegrate an area. So load is key. Again, if the dancer can do that, obviously there are many indications where you need to be unloaded because the tissue needs to heal. I think that you can use your price principles for acute pain, making sure you're not dealing with any kind of Raynaud's phenomenon. You should not use ice in that kind of situation because it could further damage the skin. But I think using those principles when needed are really effective, especially with joints that might be, hyper irritated. I will ice, ice is a very controversial topic. I will use ice in acute situations to manage inflammation. I don't want to decrease inflammation. I want to manage it, but I've been getting into more contrasting and using alternating heat and ice, even in acute situations, just to kind of increase the blood flow in the area. And then in a more chronic pain situation, a lot of my dancers who have hypermobility can't take any pain medications. There's way too many side effects. Their bodies cannot handle something like that. So I instead will then look at different kinds of splints, bracing, taping, padding that can help to increase the stability of their joints, give them that more of that kind of proprioceptive sense, and can relieve some pain. And certainly there's wonderful taping techniques that you can do at the ankle and the foot. that can really help kind of give you that more of a proprioceptive sense, or maybe even some of that passive support that you might need outside of class, which kind of, or the studio, which leads to kind of more of my last two things about the feet. I think it's good to wear sensible shoes. That doesn't mean ugly shoes. It doesn't mean wearing a mattress under your foot either, but a good supportive shoe. If you have a hypermobile foot, or you're dealing with chronic ankle instability or chronic joint subluxation, shoes that have a really strong heel counter, that's the back of the shoe. It's got to cup the heel. Shoes that have a midfoot control, so a lace-up shoe is better than a slip-on, and some kind of cushioned sole. Certainly, here in New York City, we're walking, to walk 10,000 steps a day is like half your distance you're going to walk on a normal basis. So you want to have something that can provide some kind of shock absorption when you're walking on asphalt and concrete. And then finally, taking care of your skin. There's so many weird, funky little things that can happen in your feet with your skin, and, managing your calluses, managing your blisters, your splits, your nails, treat corns as soon as possible, because those can be exquisitely painful. Am I right? I think I am. I mean, exquisite pain. And then if you're dealing with a foot that's not well controlled because you're working with an injury, or you're having issues with stability, you're going to alter your mechanics of your foot to kind of avoid putting pressure on those areas, which could then, I think, lead you to potentially developing an additional problem.